we had a nurse, Karen Sakakini, who's a cardiac nurse, and she has to cool babies down before cardiac surgery to protect their brain, and then you have to, of course, rewarm them back up to normal body temperature. And she had felt that the rewarming technologies that were available to her, basically water baths and blankets, weren't very effective. So she came up with a novel idea to create a thermal hat for rewarming. Basically, if you think about it, you lose 40% of your body heat through your head, so wouldn't it be a great idea if we could capture that heat and help the babies warm up more quickly? So she came up with the idea of a Mylar turban-style hat that lies flat on the operating table and goes on, is fastened with Velcro on the babies. And she got one of our innovation grants and went on to do a pilot study, show that it worked, and get a patent, and it's now being licensed out. So this is not such a high-tech example. We still consider it actually a medical device, but an example of something that we've supported. We also do a lot in the area of digital technology. I mentioned our Fast Track Innovation and Technology group. We really think that the digital transformation is happening now in healthcare. Many hospitals today now have medical records in place, and they're charting electronically rather than on paper. And people are starting to really think about what is the next frontier. And the next frontier really is around increasing communication between clinicians and patients, and efficiency, leveraging the devices that we've all gotten really comfortable with. So really trying to figure out how to use tablets and mobile phones in the delivery of care. And so we built a couple solutions with that in mind. We came up with a solution called DISCO, which is short for discharge communication. This is actually a FIT award. And the doctor, what he wanted to do was figure out how to communicate with patients after they had been sent home from the hospital, after they had been discharged. And he thought, you know, everyone's carrying a cell phone. Why don't we send a text message out to our patients? And so we built a communication platform that allows us to send text messages to our patients to ask if they have their medications filled, if they have any questions, how they're doing. That information then comes back to a nurse at the hospital in a dashboard that was built by my team, and shows which patients open the text message, what the response is, and then she can figure out who she needs to actually follow up with a good old-fashioned phone call to check in and see how we can support them. The discharge communication DISCO pilot went really well. We didn't see patients being readmitted, but the sort of surprising benefit we found was that patients also really liked this tool. They felt that we were staying in closer contact with them. We were providing support to them after they had left the hospital. So this is another sort of big area where we see opportunity in digital transformation, which is really around patient engagement and getting them information. And so we had another FIT project called My Passport, which was actually to help patients who've been admitted to the hospital navigate their stay, because you all look really healthy, but when people get admitted to the hospital, they find it could be a really overwhelming experience. And I don't know if you've had this experience, but it's hard to get information. It's confusing. So with the clinical input, we built a mobile app that basically allows the patient and their families to see their lab results while they're in the hospital. We created sort of a more user-friendly interface that really helps explain what the ranges are. We also had heard that because we're an academic medical center, it's not uncommon for many people to come through a patient's room to see the patient. Mm-hmm. And that actually can be confusing. You don't know who's who. So within My Passport, we created a picture of everyone who's been to see the child along with their name and their role, so the patients and their families could keep track of their care team. We also made available the care plan, so parents know what's planned for their child's stay in the hospital until they get discharged. And we also allowed for sending questions to the care team, so an asynchronous communication capability in case parents or kids had questions when nobody was in the room and they wanted to send them over to the care team. So we continue to look for and build solutions that really allow us to leverage technology to solve some of the age-old problems that we have around communication and around information sharing. And I think we'll continue to build more solutions in that area.